Hello, my name is Dina Hall, and this is my Quality Improvement Project for NSG 472. I work in a unit that cares for patients who have undergone coronary, peripheral, and neural catheterizations. One safety concern that's become more prevalent in the last few months is femoral artery and groin complications post-procedure. Some of these complications can include hematoma, retroperitoneal bleeding, and formation of pseudoaneurysms. This is a significant issue because all of these can lead to extended hospital stays, blood transfusions, and even surgical interventions. It is our job as nurses to prevent and reduce these complications. One of the ways we can do this is to practice proper sheath removal techniques and monitor femoral sites appropriately. From this project, we can use the framework from the Institute for Healthcare Improvement module, How to Improve with the Model of Improvement. The aim statement for this quality improvement project is, we will reduce femoral artery complications in our post-catheterization patients by 50% within 3 months. Establishing measures is an important part of improvement and change. After we implement our changes, we will track incidences of groin complications and if they required any additional treatment. We can also track whether these complications were due to improper sheath removal by an RN. We can collect data on what types of patients are at risk for femoral complications and what we as nurses can do to decrease these risks. Evaluation of patient satisfaction scores will also be helpful, and whether they are related to groin complications or not. Nursing staff input is also important as to whether they feel our methods are improving patient outcomes and whether they are satisfied with the changes. The strategies for implementation are as follows. There's a need to increase communication between holding and procedure room nurses. Both RNs will assess the site together at the bedside while report is given. A femoral artery documentation sheet will be created specific to the unit. This will indicate the proper assessment and documentation of the site Q 15 minutes post-procedure, whether there is hematoma or bleeding evident, and what interventions took place if so. There will also be specific documentation on when the femoral sheath was removed, by whom, and a checklist ensuring proper technique. A new policy will be written that will standardize how femoral sheaths are pulled by RNs, the amount of time that manual pressure is held, and what actions need to be taken if a complication is foreseen. In-services and education for the staff on proper sheath pulling techniques will be held, and education should also be provided to the patient in regards to post-procedure complications. Last but not least, we want to evaluate the implementation of our changes. We have to ask ourselves, are our improvements cost-effective? Have patient satisfaction scores increased due to a reduction in groin complications? And did we actually reduce the incidences of groin complications itself?